Washington State crew up here. So I've got Terry and Rayanne, and they have been epically awesome at getting out and incorporating behavioral economics into the food sense program in the state of Washington. So they're going to talk to you a little bit more about their role as extension educators and using their system to get behavioral economics out into the programs that they work with.
So Rayanne and I are going to share a little bit with you about what we are doing. We're from Washington State, and some of the things that we are going to share with you today are about statewide consortiums, and some of the things are, what we're going to share are more local, things that we do locally within our county. Our county, we work with a SNAP-Ed grant, and so that in Washington State, SNAP-Ed is called food sense. And so when we refer to food sense, that's SNAP-Ed. And so basically, our audience that we work with is a low-income audience or schools that are less than 50% free and reduced. Some of the things that I'm going to share with you, I'm going to share really briefly about some of the things we do with food banks. Because when we have learned in like California, like Michigan, being with SNAP-Ed over the last 5 years, we have really been encouraged to move more toward policy systems environment. And so as we have done that, you know, we started out really with core education in the classroom with most of our educators. And, you know, as I was kind of sitting here reflecting over the last couple days, that as we look at all the different areas that we could, you know, you can venture into now, like gardening and physical activity, that really smarter lunchrooms and behavioral economics is the area that we have really been able to move forward very progressively with. And that really, I believe, is because of the resources that we have available to us through Cornell and the resources of having Kate available to us and being able to come out and train our staff. So, so that has been really monumental in how we have been able to move forward pretty progressively doing smarter lunchroom design. Okay, so how we got started with behavioral economics. In 2002, in our area, the Department of Health, which is the regional health district, really was one of the leaders. And part of that is because the health specialist person with our Department of Health used to work in our SNAP-Ed program. And so I think when she got to the Department of Health, they do more of you know, media. And she knew that we had a whole army of little workers that, that they could collaborate with to reach there. So collective impact really started with the health district recognizing that they had a little workforce out in the community that they could collaborate with. And so the health district sponsored a workshop, and Dr. David Just came out in 2012 and did a workshop for food service directors and local health professionals and our local farm to school network, which has really become instrumental too in the work that we've done in cafeterias. So from there, we kind of have a three-pronged approach in our area. Spokane is one of the largest counties in the state, and we do have the largest SNAP-Ed program in the state. So we have quite a large staff. We have 18 educators, and we have another 8 hourly. So we have a staff of over 25 just in our county. But one of the largest collaborations we have in our area is with a local food bank. And so we reach probably 25,000 adults a year with nutrition education and in food banks. And when we work in food banks, we do a pre-post behavior checklist survey. And when those surveys come back, one of the things that we kept hearing over and over and over again is that we would love access to more fruits and vegetables. You know, we want access to more fruits and vegetables. We're not seeing them in our food banks. Well, at the same time, our local food bank, which is Second Harvest, was gaining a relationship with Feeding America. And so they had tons of free produce that they were willing to just give to local food banks. Well, local food banks wouldn't take it because they didn't think they could get rid of it. And so here we have an audience of a population that is wanting the fruit and vegetables, and over here, our supplier, our local food bank that has all the free fruits and vegetables that they want, and there's no middle ground to meet those. There was such resistance in the middle with the food bank managers. And so what we were able to do is work with some of those managers and food banks, and so that is why we're including that today. So on the other hand, working with our school districts, so our local health district decided that, kind of formed our collaboration and decided to do a pilot program in 2013. So in that program was our regional health district, Spokane Public Schools, which is our largest school district, and then our WSU Food Sense program. And so with that pilot program, it was done in a middle school because collectively, I think we felt like we had lots of resources for elementary and not a lot of resources for the middle school. And so the object of the pilot program was actually to put together a toolkit directed at middle schools for smart lunch. And so included, this is just kind of a summary of the activities of that pilot program. So we did waste studies, we had production records, taste tests, and we did a school-wide attitude survey with the kids. So the students, so one of the things that was really fortunate was that we were able to involve students in the pilot study and in the whole process. It started out with doing focus groups with students to find out their ideas. So the students had Chef for a Day. They were able to put together some recipes that they wanted to see in the cafeteria. They did student testing and recipe testing with the recipes that they developed. They did worked with the graphics design classes and the art classes and did posters. They did some videos and they did PowerPoint. So the students all joined together as part of the pilot program. So the focus groups, what they wanted to find out from the focus groups is what will the students eat? And so we got student perceptions, they did some naming, and then we had a Chef for a Day contest. So here were some of the student photos and posters. And as you can see, we were kind of liberal with with what they could move ahead with. But one of the things was that the graphics class and the photography class said, we would love to do these posters. We don't have funds to go out and purchase fruit to go do this. So a local Safeway store produce department said they let the kids come in and choose anything they wanted at the produce department to make their posters. So this was an example. In the posters, after the students finished the posters are now framed and hung up in the halls of the schools on the way to the cafeteria. So, they are being used as an environmental support to support the changes that were made in the cafeteria. So another focus group of students created names. So these were their names and their graphics that they devised. So these were some of them, and they actually ended up, they are using these in the cafeteria, and they were all middle school students. So crunchy, munchy, marinated veggie salad, sunset salad was a carrot raisin salad. And so also having the names of the students kind of gave them the ability to do kind of a mentoring and modeling too. So, which was one of the persuasive techniques using to influence change behavior with the students. So, just a summary of the pilot program, they nudged it. Actually, we used the nudges to nudge kids into eating healthier. They built a consensus, so we did some consensus boards in the cafeteria. They had written goals, implemented their plan, and they used videos and evaluation techniques in pilot program. So that was our first pilot program that we did. So then in 2014, we kind of moved a little bit more into the food banks because of the comments that we had between our food bank participants and our large food bank, that joining these together and getting access. So we did a local training for 50 Eastern Washington food bank managers at a local conference. And from there, we also went on to the Washington State Food Coalition, which is our statewide agency. And we did a very, very basic presentation and workshop on helping the food banks in our state use the nudges, just the simple nudges, to look at different aspects of food banking, how they can lay out of their food bank, how they can lay the food out, how they can name the food, signage in the food banks. So they were able to implement a lot of the nudges. Now, this is one of our school pantries that has a food bank, and this is one of the things that's developing more within our schools, is school pantries. And as you can see on the left, this is the school pantry with everything stacked in the halls. There's coats hanging up, things are in boxes. It was filthy dirty, and there was a lot of stigma attached to using the food bank between the students. So our educator that was in that school said, okay, we have this great presentation, from Kate on smarter lunchroom, but we're going to take it into the food pantry. And so they cleaned it up, they put the fruit baskets, they labeled the shelves, and now they're still working on signage on the outside and doing some announcements and being able to make that place a welcoming place for students that have a need for food to come in and get it without stigma, and to feel like they're coming into a warm, welcome environment. So this is kind of our beginning of food pantries. So I guess that one of the resources that we're kind of looking for out of this is maybe a tool to go into school pantries or food banks, an assessment tool, because we're just kind of loosely putting together the nudges and using kind of a loose assessment. So, but we're finding that this is an audience that is really wanting some help in the environment, in helping people choose healthier. So one of the things that we are able to do with this food bank is we do a mobile food bank in our schools. And so we learned through trial and error not to just come with the food bank to the school, but what we have learned is to find a big event that the school is doing, maybe book bingo, something where a lot of families already come, and then the food bank will come in with a semi-load of food, and we're able to distribute that to families. So one thing that we have learned through, whether it's the cafeteria or whether it's food banks or mobile food banks in schools, is that sometimes efficiency is the enemy of smarter lunchrooms. And that just wanting to get things streamlined oftentimes will kind of impede your process of giving people a choice and letting people choose. And so here we always thought, okay, we'll get things all bagged up, ready for the families, so that when they come in, they just sign up, give their bag, and go. Well, what we found out was when the people were coming through, they didn't have any idea what was in that bag. They didn't have any choice what was in the bag. And so, so what we are able to do now is we use some of our smarter lunchroom techniques. And one thing that we always do is put recipes in so that people know they have something to do with the food. In our food bank classes, we have cooking demonstrations so that the people actually see what they can do and have to use their food. So what we did is, as you can see on the left, we have the food bagged up ready to go, but in the front we put a basket out that shows them this is what you're receiving tonight. This is the food. We try to make it look appealing. here this was kind of out in the sun, but so that they know and they feel like they, you know, they're treated like a customer, not a food bank participant. So that was some of the things that we've learned and that we've been able to do using the kind of smarter lunchroom in food banks. So going on, this year in Washington State, we have been the recipient of a Team Nutrition Grant. And so we are working statewide with our Office of the Superintendent of Public Instruction, Child Nutrition Services. And so statewide, this is a statewide grant, and we are collaborating with OSPI and with Washington State Extension and throughout the school. And so Rayanne has been working pretty extensively with the schools in Spokane County on this Team Nutrition Grant. So she's going to share some of the things that they've been doing.
Well, it's my privilege, yes, to share with you about a project I've been spending a lot of time with, but just a little bit about my background. This is my first year with Extension. I do have a background in school nutrition. Was a director for 10 years prior to this. My favorite part of the job was nutrition education, and so to have the opportunity to get into Extension and work more in nutrition education, but I have even the more exciting job because my position is specifically behavioral economics, and I get to work with cafeterias. So as you can tell, I like my job. But I've only been doing it for a year. I hope that just by me presenting kind of the things we've been doing might spark an idea to keep this movement going. I really liked Kate's word about developing. So we're still learning, we're developing. We're kind of at a different stage than California, Ohio, Michigan. I feel like we're kind of, in some ways, beginning in some of this. So we, like Terry said, we're partnering with the State Department, Nutrition Service Department. We, in Spokane County, we're working with one district, 3 schools. Statewide, this is our Team Nutrition Grant. There's 25 schools, so we're working with 3 of those schools. And it is a pilot project. The purpose of the Team Nutrition Grant is to implement Smarter Lunchroom, determine the success, what are our successes, then and statewide get together, the counties share what worked well, get a toolkit developed. We are in year 1 of 2 of the grant. So there are specific guidelines, like with grants, on what has to be done for the project. So I'll share real quick. I bought the rights for this, we bought the rights for this dog, superhero, to teach about carrots, eating carrots. And so then we went to a Smarter Lunchroom, and Kate talked about superheroes and how kids are into superheroes, and can you make, then this project is specifically with elementary schools that we're working with, these 25 schools. And so the cool thing was the director was right there with us at this meeting, and I showed her this superhero picture, and she loves dogs. And so that really helped, and she goes, we are going to use this, and we are going to get the kids to help us name it. So, that really drew her in, and she got excited about it. So we did. That's just what we did. We have a naming contest, and I think the way we designed, I like the way we designed our contest because it involved all 3 schools. We had 4th and 5th graders submit names. We had 4th and 5th graders submit the names. Then adults selected a winning name. That was tough because I wanted to select them all. A winning name from each school. And then each school, then we had a vote in the cafeteria. So on flip charts, we wrote the 3 names. And then everyone, one day in the cafeteria, we ran a voting event. So each school, we made a prize, that's a prize basket, so, and that was one of the winners below of the school. So in the 3 schools, everybody got a prize, or the winning name, submitted name for the finalist. And then this is our winner, our final name, and the name was Captain Canine. So Captain Canine, and the kids knew ahead of time that Captain Canine was going to be teaching healthy choices. So we kind of got their buy-in from the beginning. They say, you're going to help name this. He's going to be teaching healthy food messages and teaching healthy choices in the cafeteria. And so they're post-cap. So at the same time, we were determining the goals, and this was definitely directed through the Nutrition Services Director. And these are the 3 goals she wanted to focus on: promoting white milk, one entree that's more freshly prepared, and then increasing fruit and vegetable consumption specifically. So we are also doing all the data collection. We did the Smarter Lunchroom. We did it in 3 schools. We did it 2 times in each of the 3 schools, because in case they had an off day, we wanted to be sure that we were catching that. Collected numbers from production records. I'm anxious to hear more about the method tomorrow, or more about how that's done. We took pictures and then did some visual. For the post data, I'm going to make sure that we pick the same days that we're evaluating on the menu cycle. And then we did a 2-hour training on the Smarter Lunchroom with the teams. Then we rolled out Captain Canine and had media coverage, which was great. We focused just on the milk to begin with. The schedule on the far side is the Nutrition Service Director put that together. Captain Canine doesn't stay in one place in the cafeteria. It moves each week, or he moves each week. And that is a schedule for the staff on where Captain Canine moves. And so we created low-cost props. You notice he's about the size of he stands fairly high, and not, with kids, and they kind of eye level. And the Nutrition Service Department helped get that printed, helped build the stand. And then we created these to focus on the targeted entree. We created these PA print menu boards, and just used chalk paint. And this is how we have supported the project through INTERCOM announcements, talking bubbles that we've created, classroom nutrition education. The grant is written so that we do nutrition education in 2 of the schools, and 1 school we do not, and we'll evaluate that, how much the nutrition education supporting what's going on in the cafeteria has made a difference. We've really focused in on supporting their Harvest a Month. They have that every Thursday, and we are committed as Food Sense staff to be in there helping serve and often, and helping with verbally cueing kids. We use these I tried paws and stickers. We created newsletters and 10-minute kitchen trainings. We have done 3 of them, and I'm really excited about it. But we focused on verbal cues with the staff. We went around to all 3 kitchens, did training right within the kitchen, real quick with them. Verbal cues, offer bar, and targeted entrees. So we've done. So these are kind of an example of an announcement. Find that creating, especially for Harvest of the Month, and creating excitement around the vegetables and having as many announcements and creating those relationships in the school buildings with the office staff, and being able to get these. Kids are reading at one school, so I've got a contact with the leadership class. A PE teacher is reading at the other, and so it's easy to get these read. And then we have talking bubbles, and I've created lots and lots of these, but we have them for all of the goals. So I'm showing you the white milk, the targeted entree, fruit and vegetable consumption. And then we've done other things with consensus, getting kids to sign their name that they ate, and putting them up like on the board. And tasting tables. So there's an example of our parent newsletter. And I have on there the Smarter Lunchroom, you know, what's Smarter Lunchroom and all the newsletters that we've written. And I just wanted to, you know, this has been a big thing, the likability and just getting the staff. They've seen how much fun the kids are having, and that's kept the momentum going for them because they see it's fun. So for Superhero Day, their supervisor, the Nutrition Services Director, bought them each of these cakes, and I did a little talk, Captain Canine talking bubble. And we just know that likability, kids are more likely to say yes on anything to people they like. And so just creating that, and they've really had fun with it. And I'm hoping that this is going to be part of our sustainability piece, is that the staff just really sees how it works. They get behind it. They see that, you know, we can keep this going. It's fun. Kids like it. And so here, then we're going to be at our evaluation piece, and it's been the amount of time is a little questionable about how the evaluation piece is going to come out. We are going to repeat here within this next few weeks. We'll be repeating the Smarter Lunchroom scorecards. Then the next step is to get, and we'll be collecting all the other data too, and then sharing that with our state agency. I hope the state agency is sharing that with you too, Kate.
I'm hiding behind this pillar.
I've got to check with you on that, but we've been sending the data, so hopefully the state agencies like giving you that. And then we're going to create a toolkit, and then the next step is to work towards the Healthy U.S. School Challenge application next year, and getting those success stories out. Any questions on that, or I'll let Terry show your success story. Oh, here's my our success story. So just how much fun it has been recreated in the cafeteria. We know it's been noticed by teachers, kids, even the older kids.
So our teen nutrition grant in our own county has been working with one school district and 3 schools statewide. I think there are 25 schools, and as soon as the pilot project is done, our state intends to require all schools in the state to implement Smarter Lunchrooms. So that is one part of it. So with the teen nutrition, the way that we support and collaborate is with the INTERCOM announcements, the Captain Canine talking bubbles, classroom nutrition education and recipe testing, support in the cafeteria with Harvest of the Month, the I Tried It cause, parent newsletters, and the 10-minute kitchen training. So we're really excited about the additional 10-minute kitchen trainings. So this is kind of how it was outlined with our state collaboration with Child Nutrition Services, local school districts, and WSU Extension, and then our local collaboration for the teen nutrition was Central Valley School District, their school food service, and Extension. So another grant that we are working with is in our state we have a collaboration where one of our hospitals sold out, and so they were required to pull together a foundation with those funds to look at healthcare in the community. And so this entity is called Empire Health Foundation, and they have targeted childhood obesity as one of their targets. And so with that, what they have done is given 3-year grants for scratch cooking in school districts. And so our largest school district has finally agreed. They've been luring our largest school district for about 5 years now. Finally, they have agreed to do a pilot project with about 10 of their schools. So we're working with the Spokane Regional Health District, Spokane Public Schools, and Empire Health Foundation on this scratch cooking. And as part of that, we are doing the Smarter Lunchroom assessment. We're doing the waste testing, and working with nudges in the school signage. And one of the things that we're working on with this is working on persuasive techniques. and how the food is offered. And so we're doing really quite a project with the health district and with the community of extension to put together a whole program around persuasive techniques. So I would say the essential ingredients for collaboration is we all have a shared goal, and that is encouraging students to eat the healthy food that's available. They have wonderful healthy food in the cafeteria, and we want the kids to eat the food. Communicating between all of our entities has been really important. Training. I think we've used the 2-hour training. We've had Kate out, I think, 3 times to do trainings. We're working on the 10-minute trainings with school food service. So training has been a really important aspect of making Smarter Lunchroom a success. And then building relationships between the collaborators, between the schools, between the food service and the students. And so the relationships really go full circle. And then the structure of our collaborative team. So we have, with each of our kind of districts, we have an amazing city where people will collaborate without, without wanting their personal agenda. And so we are able to collaborate with our food banks. We have 4 universities in our city that we are all, between the health district and extension, are able to, I don't want to say use interns, but we have interns available to us, and so they help us, with a lot of the data collection. And so we have the Department of, with the Farm to School, we have the Department of Ag. The Dairy Council in Washington State has been an integral part of really a support. And then just the school cafeteria staff, school districts. So building all of those relationships so that we do have collective impact is really important. And then what's unique is that originally the health district was a driver, and it's just really surprising to me when you go into a school or a food bank or an entity and you say you're working with the health department. They just become so cooperative. So we've used that too. Our local school districts, the food service, we have 8 local school districts that we work with, and their food service, I would say, have been really very cooperative. Empire Health Foundation Scratch Cooking Grant has enabled funding, and so that has been a really important aspect. We have a local farmers co-op that actually has formed so that we, between the scratch cooking and the increasing fruits and vegetables in the school, we have been able to purchase and use a lot of fresh local produce. And then I think for us, we have been very fortunate to have Rayanne on staff as a behavioral economics position with a food service background. Has really taken us to places that we wouldn't have been able to go with just our local extension staff in schools. So we've been very, very fortunate. And so we've had lots of successes. The scratch cooking in schools has really helped integrate Smarter Lunchroom. The cafeteria tastings have been successes. You saw all of the things that we were able to do collectively with the school. With the Teen Nutrition Grant. It's been a learning process too, and like everybody has said, you go in to do the data, you go in to do a plate waste study and they've changed the food for the day. Or, you're going in to do a testing and all the lettuce came in frozen. So you just work around those things, you become flexible. I just laughed because someone was talking about take pictures, so you can implement. And so when we were at the waterfall yesterday, I was trying to take pictures of this beautiful waterfall, and I had, 600 pictures on my phone and no data left. And so I have a whole load of cafeteria pictures on my phone, 600 pictures with probably 25 of those that have media releases. And so one of our failures has been that when you go in there and you're taking pictures and you know, if you have students in them that you want to be able to use to show your districts and to use in parent newsletters and for the media, if you don't have those media releases, you don't have a lot of place to go. So one thing that we have is all of our staff carries the media releases with them in their binders so that we have those available with us to be able to show what we're be able to be doing in the schools.
It's a great tip.
I know.
It's a piece.
All right.